Our guest today is physician associate that specializes in cosmetic dermatology. Please help me to introduce physician associate Denisse.
Hi, everybody. How are you?
Thank you so much for sitting down with me and doing this.
Absolutely. Thanks for having me. I'm excited to share some of my pearls today.
Awesome, awesome. So I want to get right into it. I'm so excited about this interview. Can you tell me, how did you get started in the cosmetic dermatology industry? Like, what piqued your interest and what were the steps that got you there?
I think my story is similar to others. I started out in hospital medicine, emergency medicine, particularly. When I was in PA school, I really knew that I loved hands-on procedures and taking care of patients in a procedural way. So I went right into emergency medicine knowing that I could do stitching and splinting. But after 3 years of being in emergency medicine, I had a friend who came to me and said he was opening up a med spa. At the time, I had no idea what that was, and he gave me some information about it. I did my own research, and I have always been into beauty and makeup. So I thought, this is really interesting. He's like, why don't you go take a couple of courses, get certified, and then you can work for me once a week. So, I thought it would be easy, and I went in, I took my courses. It was horrible, by the way. I did not feel like the company that gave these courses was good in any way. So I came out of that class feeling very lost, but I did know one thing is that it definitely sparked my interest. So, I decided that I took the plunge and that I was going to change my career completely. And that's the beauty about being a physician associate, right? Is that we can actually switch specialties. So I went ahead and I decided that I was going to switch over to dermatology. So for several months, I was looking for a job just like everybody else. It's not an easy specialty to get into. It's very competitive. And I had a lot of people close their doors on me and say no, but I was persistent and I ended up taking a job that was an hour and 20 commute from my home one way.
Wow.
But the sacrifice, looking back at it, was well worth it. And I definitely don't regret it. So I started out specializing in just general dermatology. I did about 50% medical patients and 50% cosmetic patients. And now I do work primarily in a cosmetic derm practice where I'd say 80% of my day is cosmetic patients, but I still see medical patients like acne, scars, eczema. And I do enjoy that aspect of it. I get to do skin checks on people and I still get to remove cancerous moles and things like that. So I still get to do some of the surgery that
Amazing.
I loved. Yeah.
And that's a good, it sounds like a good balance of both, right? Correct?
Yeah, definitely. I mean, I feel that my true passion lies in cosmetics, but I really enjoy the medical aspect of it. I enjoy taking care of people and being able to prescribe medications and help with their skin and put people on Accutane. So I really enjoy the balance of both. And so that's how I'm here.
Now, I wanted to go back and kind of touch on some things that you said. Now, being a PA, I know nurse practitioners are very similar in that realm, as far as like the things that they can practice, the scope of practice, and things of that nature. When entering school, how did you know you wanted to be a PA? And I also know that you were like one of two that were able to enter advanced PA program. So
Yeah.
how did you like, what made you want to do that also?
Well, I was lucky in that my whole life I thought that I wanted to be a physician and I wanted to go into medicine. So that part of it was pretty easy for me. Ever since I was like 5 years old, I knew I wanted to be in medicine. But once I got to college, I kind of started to think about more of what I wanted in life in general. So I wanted to definitely not be in debt and a whole ton of debt. I wanted to have that really nice work life balance. And so I discovered the physician associate profession. I met someone in my healthcare department's office who said that she had just gotten into PA school. And I was like, what's a PA? So I was only 18 years old at the time, and she explained to me exactly what it was, and that she did undergrad for 4 years, and then she went on to a grad school program that was 3 years. And I was like, well, that's perfect. It seems like it's the perfect balance of me not going to school for like 15 years, but still being able to prescribe medicine and treat patients autonomously, diagnose patients. So that's what sparked my interest in the profession. And I really like that PA school we are trained to, during the training, it's very similar to medical school. So a lot of my classes I actually shared with medical school students.
Wow. You said you trained a lot with like medical students. It was a lot of
Yeah.
more medical classes. Do you think you got a deeper understanding?
Definitely. I think that the model that we're trained in is very similar to medical school. It's just an abbreviated version of it. So instead of doing it in 4 years, we did it in 3, and some programs I know do it in 2. But we did have a summer break, a 2-month summer break, which is why we did it in 3. But some PA programs are 2 years because they have no breaks in between, not even Christmas breaks. So
Wow.
I was younger, I was 18, so I felt like I was able to afford the 3-month break during school.
Yeah, definitely.
Yeah, yeah.
Now let's go back into aesthetics. You are really great at facial balancing. Like I look at your photos and I'm like, wow. Could you explain a little bit more about it and why your technique on it is so amazing?
I love to talk about it. So facial balancing really means that we're treating the patient's aesthetic face from a global perspective. So if a patient comes to me saying that they specifically want lip filler, I'm not just going to go in, grab my lip filler, and start treating their lips. I'm going to have a deeper assessment and understanding of what other surrounding structures can make that whole area look better. Um, so facial balancing is about trying for our patients to achieve those standard proportions. Now, I don't want everyone to look the same. Of course, beauty is not standard, but the closer we can get them to that, and the closer that we can get them to look natural is most important. Sometimes if you treat just the lips without analyzing their marionette lines or their chin, they might end up actually looking unnatural. And that's what patients don't want to see. They don't. That's the negative connotation that we have in the aesthetic field, is that certain areas that we treat is going to make you look like plastic or unnatural. So that's why I really like to focus on facial balancing. And that's really what facial balancing means, is looking at a patient from a global perspective and analyzing all the different areas that we could possibly treat. I hope that answers that question.
No, it does. It does. And I can definitely understand that. And I can definitely understand that, everybody's face is different, but looking at it from like a different perspective helps. That's amazing. Um,
Exactly.
now, I know you are one of Allergan's trainers. Can you explain a little bit about how you got that and how was the process? And for anybody that might be interested, what they can do to kind of begin that journey?
Yeah, absolutely. So it all started, I think, about a year, 2 years ago. I had a couple of inquiries on my Instagram DMs asking if I did teaching, and I never had really considered it. And I decided, you know what, why don't I start teaching too? So I started out doing like a couple every 6 months, and then I realized that I really enjoyed teaching, and my trainees really enjoyed working with me and seeing me as their mentor. So I decided to start my own training company, my own private training company, and I formulated a great relationship with some of my reps, and they knew that I had my own private training company. I invited them to see and watch me inject. And I guess I must have really impressed them, because I was asked to be a trainer for their company, and now actually for Galderma as well. So um, it really started with my training company, where I realized that I enjoyed teaching, and then just having my reps watch me inject and having a great relationship with my BDMs, business development managers. So
Wow, that's great, and I really want to emphasize on that a little bit, just because from you when you just told me at the beginning of your story how you used to drive an hour and 20 to work, to now where you're at right now, being a trainer, working in a great practice, it shows like the hard work and dedication. Can you tell us or give a little advice on any new providers that are entering the field, or even experienced providers looking to switch positions? Um, what it takes, or what they can do to kind of get to that?
I think definitely determination and persistence. I'm of the belief that anything is possible if you put your mind to it. So making sacrifices, that's what it comes down to. I couldn't find an aesthetic position that was anywhere near me where I was living at the time. So I decided that I would commute an hour and 20 to an hour 30 one way every day just to get to where I am. That might mean long commute, relocating, definitely trying to get in with a dermatologist or a plastic surgeon is a great way to start. I know that there are several med spas in New York City now that offer training as part of their curriculum to eventually have you as an employee. So maybe looking into that. I wish that was existed like 4 years ago when I started out in the field. But nowadays, you can even do things like that. There are certain recruiting companies that also offer trainings themselves for aesthetic providers. And the field is booming. So I think, if anything, nowadays it's a little bit easier to get in. Not that it's easy in any way, but there are definitely more pathways that people can take. So not giving up, I would say, is the main thing. Oh,
Great.
and networking. Networking is very important. So attending aesthetic conferences, and even if you're not an injector yet, you never know who you'll bump into.
Oh, great. Yeah, no, those are all really good tips. I totally agree. And you're right, in the New York City area, not so much in the other areas I work in, but definitely in New York City area, there are a couple of med spas I'm very familiar with that you can come in and they'll teach you from scratch, and you'll
Exactly.
work inside their spa. So there
Yeah,
definitely are opportunities out there.
exactly.
Speaking of New York City, it's like it's so interesting because I am based in South Florida, and it's like the mecca hub of, like, I feel like aesthetics. Everybody's
Yeah.
walking around and they have aesthetics done. Can you tell us a little bit about the market in New York City and how aesthetics is kind of viewed and how the industry is there?
I've noticed I've had a couple of patients come to me from Miami, and I definitely notice a difference with the aesthetic eye with providers in Florida versus New York City, and how patients themselves view facial aesthetics. I definitely think it's a little bit more conservative in New York City. Like, people do it, but they don't want anybody to know that they're doing it.
Mhm.
At least that's how I view my patients anyway. They also are not into lips as much, but they want other areas treated. They're definitely a little bit more about the organic version of aesthetics. So they're looking for like biostimulatory agents that will reproduce their body's own natural collagen and things in that nature. So I find that it's a little bit less flashy. That's the best way I could describe it in New York City. But I think little by little, especially with millennials, it's becoming more common, and people are less afraid to talk about it and to admit that they're actually getting it done. So that's good.
Yeah, it's like a stigma, I think, around it. And the
Yeah,
stigma is slowly changing as the years go on because it's still a pretty new industry.
it is. Yeah, in comparison to other areas of medicine, absolutely.
How so when you're speaking with patients, and I know you just said in New York it's very conservative. If you ever got a patient that wanted to get maybe something that was out of your range, or like maybe like an overfilling, what do you tend to do in that situation?
Well, thankfully, I don't feel like that happens to me a lot because what I put out into the world is what I attract. I think a lot of patients come to me because of my natural aesthetic eye. But if and when that does happen, I just have a very honest and genuine conversation with them, and I let them know why that maybe that treatment that they're looking for is not suitable for them. And honestly, I've really never had anybody say to me, thank God, that they want to look fake, that they want to look unnatural. Nobody's ever said that to me. Or, if I say to them, if we add any more cheek filler, it's just not gonna, people are gonna know that you're getting work done, and it's going to be, it's gonna look unbalanced with the rest of your facial features, and patients really get that. I've never had any pushback once I have an honest conversation.
Okay, awesome, awesome.
Yeah.
Is there any aesthetic providers or doctors on social media that you could recommend for newer or experienced injectors to follow?
Yeah, I mean, I think more so than Instagram, I do feel like it's more who's a great leader in the industry, who's a great teacher. So there are definitely a few, like I have my great friend Heather Rypian, Park Avenue RN. She doesn't have a huge Instagram following, but she's a huge educator in the field, and she's really skilled at what she does, and she trains all over the country for Galderma. Her Instagram name is Park Avenue RN. So someone like her is someone great to follow. My one of the people that I really look up to is Nicola Lowry. She is a great educator in the field. I think she does really natural aesthetic work. And the way that she injects is very focused on balancing and anatomy, which is important. Let's see, I also have trained with Erica Berry, Injector Bunny. So I think she's also somebody great. She has a Patreon online that you can subscribe to, and she has some great educational videos. So those are some great leaders in the industry that people can look up to and follow. And yeah.
What about some great conferences or networking events that people can attend?
So last year I was actually faculty for the Aesthetics Extender Symposium.
Wow,
I feel like that's a really great conference in Florida,
nice.
run by Christy Lennox. There's some great topics that are discussed there, great networking opportunities. I also really like the AMSPA conferences. And if you're already an injector, whether you're beginner or advanced, Chris Surek's Academy for Injection Anatomy, it's a must. That's probably my favorite conference that I've ever been to. I've been to it twice. Not only is it great for networking, but it's also very important that you take a cadaver course when you're an injector, so you can see the anatomical structures live. So those are definitely like top three of my favorite.
Nice, nice. And I will drop all of those below so you can go ahead and click on those, check those out, and the injector's name so you can go ahead and follow them to gain some more insight. So I wanted to talk a little, and you're also a society, you're part of the Society of Dermatology Physician Assistants, correct?
Yes, and I am also part of diversity in dermatology. I am their aesthetic chair. It's a very new organization. So this year they have a conference, but they don't have an aesthetic portion yet. So my hope and goal is that by either this summer or next summer, we have an aesthetic portion to the conference set up that I'll be running and leading. So if anybody is interested, if there's any dermatology PAs watching, definitely join diversity in dermatology, join the SDPA, but be on the lookout for next summer's or this summer's conference. We might have an aesthetic portion, which I know a lot of people would be looking forward to.
That is huge. That's huge. And what do you guys, I guess, what does the what do you guys focus on? What's more of the mission of it?
Diversity in dermatology, we really want to hone in on skin of color and make sure that there's no racial disparities in dermatology medicine. This summer, or this spring, excuse me, they are hosting a conference in Florida.
Oh,
But a lot of the topics that will be discussed will be more like medical dermatology, so eczema, psoriasis, vitiligo, and things in that nature. But I know that we are certainly looking forward to adding an aesthetic portion because, of course, aesthetic medicine is part of dermatology. So that's really what our focus is on. And I know that there's a ton of derm NPs and PAs that would be excited about that.
yes, for sure, for sure. I even have to look that one. That is amazing. I think that's,
Yeah, if you want, you can certainly link it to the video.
yes, for sure, for sure, for sure. Now I wanted to talk a little bit about, I see that you're pregnant. Congratulations.
Yeah, thank you.
Now, a lot of injectors are going to go through this. They graduate college, they start their career, and they start their family. Can you give any advice, tips on how they should approach that, as far as like how long they should work, or any tips you can feel like you're going through right now that you want to share?
Well, I'm still going through it, so I think it'll be better to ask once I, have done the whole maternity leave thing. But it really depends on how you're feeling and your health. Listen to your body. I honestly, I'm blessed. I've been feeling pretty good, which is why I've been working a lot. I'm actually working more now than I was before I was pregnant. But I enjoy it and I'm feeling okay. So I would say just keep doing what you're doing. We got this, mamas. We could do both. We could be moms. We could be career women. My whole life, my mom worked and she raised me, and it worked out. So we could do it. We just have to. It's all about time management, which it's really the most important thing, and having like a schedule, writing things down. So that's what I hope to do. And when I end up going on maternity leave, I definitely plan on focusing on my newborn baby and kind of putting my work to the side for a bit and then coming back stronger than ever.
And I wanted to touch on that so much because I know this field is majority women, and I know they go through a lot like this, and obviously I have no idea. So I wanted to make
Yeah,
sure that you could explain at least something for them. So,
absolutely.
yeah,
And there's so many women in our field that have kids and are great career women and are very successful. So
great,
definitely shouldn't get discouraged. And I look up to them myself. Yeah.
right, great, 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 great. So I wanted to also end it in by my last question. Actually, what is your favorite aesthetic procedure?
Oh boy, that's hard. Full facial rejuvenations.
Mm,
So when I have a patient that comes to me and says, Denisse, I've been following you on social media for a long time. Look at my face. Tell me what you think I need. Tell me what you think will look more balanced and rejuvenated. And then I play. I go to town. We have a package at my office, JUVA Skin and Laser Center. It's called the JUVA Beautification Package. So basically, it's a full face rejuvenation procedure that we can get done in one sitting if you want, if you're not needle phobic. And that by far is the most gratifying procedure for me. Yeah.
oh,
And
wow,
I get to do little tweaks everywhere.
wow, wow.
Yeah.
And
Yeah.
in the Juva Center, it's legendary in New York. Can you explain? I don't know if everybody understands that. If you could explain a little bit more.
About the practice that I
Yeah.
work in. Yeah. So JUVA Skin and Laser Center has been around for 30 years. Our medical director is Dr. Bruce Katz. He is a leading innovator and pioneer and cutting edge laser procedures, and a ton of different injectable procedures as well. He was involved in the studies for Quo, the cellulite injectable, and also for the new neuromodulator coming onto the market, Daxi. So we also have a research center in our practice where we help these companies conduct these studies. So I feel really blessed to be working alongside him. We have an excellent Mohs surgeon in our practice. So it's a really great place to work at for sure.
Great, 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 great.
Yeah,
Well, thank you so much for sitting down with me and sharing your passion, aesthetics, cosmetic dermatology. Tell everyone where they can find you, your Instagram name.
sure. It's at d_does_derm. You can find me there if you have any questions. You're an injector looking to get into the field, so feel free to message me. I'm happy to share some of my tips. And thanks for watching. I'm honored. Thank you so much for bringing me onto this with you.
No worries, no worries. I'm happy that you're here. You shared so much knowledge. And until next time.
All right, bye.